I am going to introduce today's speaker. Jamine Blesoff is an instructor in the Clinical Sciences Department for the Doctor of Chiropractic and Doctor of Naturopathic Medicine programs at National University of Health Sciences. She brings with her years of experience in providing women, infants, and children with natural, preventive, and integrative care. Dr. Blesoff received her bachelor's from the University of Connecticut and her doctorate of naturopathic medicine from Bastyr University. As a medical student at Bastyr, she completed elective clinical rotations with pediatrics, Spanish-speaking population, and individuals with limited access, including trips to Nicaragua with Natural Doctors International. She is a member of the Illinois Association of Naturopathic Physicians, the Pediatric Association of Naturopathic Physicians, and Natural Doctors International. And so with that, I am going to make my face go away, and I'm going to turn the screen over to Dr. Jamine, and welcome and thank you so very much for this topic today.
Thank you, Joanne. Hello, everyone, and welcome. I'm also going to make my face go away for now so that you can have full access to the slides that we've presented, that we'll be presenting to you today. But before we do that, I want to just give a broad overview of what I'll be doing today. I'm going to expand on the bio that Dr. Janas just shared with you about myself. I know that there are a lot of prospective students, people interested in the naturopathic medicine profession, so I wanted to take a minute to just share my path and my journey to how I got to where I am today, and particularly my special interests within naturopathic medicine. And then I'll talk about our topic for today, naturopathic approaches to polycystic ovarian syndrome. I'll be sharing a case study of a patient I actually just saw recently in my practice. And then kind of talk about some next steps, maybe finish up with some advice or pearls of tips of people that are considering of getting into or applying to naturopathic medical school, and then we'll open it up for your questions. So without further ado, I'm going to make my face go away and tell you a little bit more about myself, which I have to say was probably the hardest part about putting this talk together today. I want to continue and expand on what Dr. Janas shared about myself. I attended the University of Connecticut actually on a full athletic scholarship, and I had a vague interest of getting into medicine or healthcare in some way. And as I started taking the pre-med prerequisites to be considered pre-med as a major, I also got interested in a variety of social sciences classes. I was really interested in courses that were exploring different healing systems among a variety of cultures and how that actually intersected with the healthcare system here in the United States. I ended up designing my own major, which encompassed sociology, cultural anthropology, Latino studies, with pre-medical science courses. And this major that I individualized for myself was called community health. And it was at UConn where I had first heard of naturopathic medicine as a career option. One of my college professors suggested that I look into this path because she knew that I was interested in other types of healing modalities, other ways that different communities and cultures around the world approached what it meant to be healthy and various interventions that were used. She thought that would be a good fit for me. After I graduated from college, I took some time to figure out kind of next steps, and I still wanted to be involved in healthcare somehow. And I ended up joining AmeriCorps, which is a kind of a distant cousin of the Peace Corps. It's the domestic version of the Peace Corps here in the United States. And it was a really great opportunity for me to participate in community service projects, specifically in healthcare environments. So I joined the Community Health Corps and worked in, that's where I first landed in Seattle, Washington, working with underserved communities, providing health education and helping to increase their access to healthcare services. The group that I was, my team, my AmeriCorps team, and I mostly worked with Spanish-speaking individuals at that time in the state of Washington, specifically migrant farm worker communities. And that furthered my interest in really looking into ways to provide culturally competent, accessible healthcare services, in addition to working on my own Spanish-speaking abilities. After my experience with AmeriCorps, I knew for sure that I wanted to pursue a career in medicine, but I still wasn't sure between, do I want to look into something in the public health sector, or do I want to actually practice medicine, working with patients specifically? And so I decided to take a little bit more time before making that decision of next steps and where to go to school, continue my education. So I bought a one-way ticket to Central America, which, you know, was an adventure in itself. I ended up staying quite a bit of time in the country of Guatemala. This was really twofold. This helped me improve my Spanish. I enrolled myself in a Spanish immersion program, but also just living there, even after done taking classes, really helped build my fluency and competency in speaking Spanish. And I volunteered and eventually was hired to work for a non-governmental organization. And one of my roles with this group was to develop a medical Spanish program specifically for visiting healthcare professionals from the US and Canada. And part of our medical Spanish program was actually starting a volunteer clinic where members of the surrounding indigenous communities in the town where I was living would be able to have access to basic healthcare needs where they may not otherwise be able to receive medical care. And during my time in Guatemala was another amazing opportunity for me to observe how different cultures consider health and wellness, as well as their cultural specific remedies that were used for various conditions, both as tradition that was being passed down, but also out of necessity. And I witnessed the effectiveness of using herbal remedies for some really common conditions without having to get prescription medications or go to the hospital for situations that otherwise could be found remedies through herbs or diet or nutritional changes. I returned to the US after living in Guatemala, and I decided to go back to school at a community college to finish my prerequisites for medical school applications. And because of my, a combination of my prior experience of living in Seattle and my interest in more of an holistic or natural is kind of a term that's, you know, a buzzword these days, but a holistic and different paradigm of how to look at health and healing, I applied to Bastyr University and started their naturopathic, Doctor of Naturopathic Medicine program. So as Dr. Janas mentioned, while at Bastyr, I really got interested into specific populations that I had figured out I was interested in working with. I took a lot of elective courses in herbal medicine, advanced formulations of different herbs and how to apply them to different populations and different conditions, in addition to focusing my elective coursework and clinical rotations working with pediatrics and women's health. After graduation from Bastyr, I stayed in Seattle for a number of years. I worked with one of my mentors in her private practice for about a year after graduation, and then decided to open my own private practice in the Seattle area. My office was set up primarily as a primary care office, meaning I did a lot of acute visits, you know, sore throats, ear infections, rashes, stomach bugs, stomach aches, in addition to providing preventative annual care to both kids and mostly women. So that would be well child visits, gyne exams, administering vaccines, really being the primary caretaker, kind of creating a patient-centered approach. So I think naturopathic physicians are really well suited to be in the primary care role because our emphasis is really on healthy lifestyle, prevention, and how to educate and help patients make, you know, sustainable changes in their own life.
So Dr. Blesoff,
yeah.
I know we have a lot of folks here who are interested and they're super excited about the topic today with the polycystic ovarian syndrome. So I'm wondering if we could move on to a couple of those slides.
Happy to.
Awesome, thanks.
Okay. As soon as I figure out how to click, sorry about that. Okay. So thank you for moving me along, Dr. Janas. Today's topic, Polycystic Ovarian Syndrome, or PCOS as the acronym is used pretty commonly, is definitely an emerging condition in this last decade as more and more women are being diagnosed with this condition. Some statistics show that it can affect up to 15% of women in the United States and is considered the most common endocrine disorder of women of reproductive age. So I really like this slide. As you can see, this slide is pretty all-encompassing. Any woman who may be considered or may be experiencing any combination of these symptoms may qualify as someone who has polycystic ovarian syndrome. And I think this is also an important slide because it can highlight the different ways PCOS can be experienced. So this is really going to vary from individual to individual in terms of what symptoms may present and when. The most common symptoms that bring someone to seek health care or seek their doctor for questions about what they're noticing that's different is their irregular or missed periods or change in their menstrual cycle pattern. Another common symptom is elements of what we call hyperandrogenism or elevated testosterone, other hormones that we consider androgens, which may present as excessive body or hair growth, and that is distinguished from kind of the family inherited pattern of dark hair, but this is really new, recent, or ever since X amount of time. I've noticed, a patient will say, I've noticed that my hair is growing now on my chin or on my face or on my back. Another reason that women often seek health care and may hear that they have PCOS is if they're having difficulty getting pregnant. A high percentage of women with PCOS do have trouble with fertility concerns, but it doesn't mean that it can't be addressed and managed appropriately. I've worked with a number of patients who have had success getting pregnant, even being told that they have PCOS. So I want to put that out there for individuals where that's a concern for. This is a challenging condition because it is so multifactorial, meaning that there are different contributing factors to why this condition develops. Genetics is actually a pretty big contributing factor, so family history of maybe difficulty getting pregnant or hormone imbalance or even metabolic syndrome or diabetes can predispose women to develop PCOS themselves. And also maternal health during pregnancy. So what was mom's health like when they were pregnant with the individual? Lifestyle is another very important factor, contributing factor as to why this condition develops. So how a person eats, what they're eating, how often they're eating. Physical activity is also very important, or lack thereof. As well as quality of sleep and sleep duration. There's also what we call precipitating factors or environmental factors that can be something to consider as well when we're looking at a woman with a variety or combination of these symptoms. And oftentimes the term that we hear now and are seeing in the research is this term called toxic stress, which is prolonged periods of stressful situations can change our physiology and how well our hormones are functioning. This is where naturopathic medicine can really shine because of the lens through which we study and address disease processes. The naturopathic medicine approach in itself is multifactorial, and the framework we use does a great job of looking at the individual with this condition or diagnosis versus the condition or symptom itself in a vacuum. Just to reiterate, not every woman will experience all of these symptoms, and some might only just notice a change in their menstrual cycle pattern, or that their acne gets worse, or that it's a different kind of acne. So for a polycystic ovarian syndrome diagnosis, really requires a couple of things to be present on physical exam and symptoms that a patient's experiencing, but it also needs to show that other causes or other disease processes have been excluded or ruled out to explain what the patient is experiencing. Now, there's a variety of medical and academic organizations who have come up with their own diagnostic criteria, but today I'm using the Rotterdam criteria for PCOS diagnosis. It's the most well-recognized and utilized for this condition. So I just want to this is building off of the previous slide where, you know, there has to be the presence of at least two of the following three findings in the doctor's visit. So elements that there is hyperandrogenism, which would be new dark hair growth somewhere on chin, face, back, chest. It could also mean someone who's noticed that they're thinning hair around their scalp, or concerns around balding or changes in hair quality. Also, acne can show up differently. So women who may be experiencing really deep cystic, painful acne on their face or chest or back, that may be a sign of this hyperandrogenism. Ovulatory dysfunction. This is related to our menstrual cycle, our sex hormones, such as estrogen, progesterone, follicular stimulating hormone, and luteinizing hormone. And this really will be seen as, you know, my period used to be regular every 29 days, and now I'll go, you know, I'll skip periods, or my periods are much shorter in length, and the quality of my bleeding pattern has changed. And also this means that a woman may not be ovulating that mid part of their cycle, which is often one of the reasons why they're having difficulty getting pregnant. So ovulatory dysfunction is a big part of this condition. And then polycystic ovaries, this is seen on an ultrasound. So this may be a referral that a patient has gotten from their doctor to take a look at their ovaries, and what's noticed are these little tiny fluid-filled cysts, and many of them, which can also be related to ovulatory dysfunction itself. But I do want to highlight that there's a number of women who have PCOS that will not have polycystic ovaries on an ultrasound image. So their ovaries might look very normal, but can still have PCOS. In that way, I think this diagnosis term is actually not always useful, because it implies that one might have to have polycystic ovaries, when in case that's not the case, when that's not true. So I just highlighted a couple of points down here with regards to the exclusion of or ruling out other disease processes or conditions that may explain some of the symptoms above. So your doctor, or if I'm working a patient up, I definitely want to check their thyroid function, their pituitary gland, and adrenal function as well, adrenal glands. And I just listed some conditions that are associated with each of those organs. I have a comment here about the term syndrome. Syndrome is usually all-encompassing, multiple symptoms and multiple physical exam findings, but it doesn't always make it a unique experience for each patient. And so this syndrome can sometimes be what's called a diagnosis of exclusion, where we ruled all the other stuff out, but you still have this pattern of symptoms, so you qualify now for this syndrome. I do want to comment on complications and concerns with someone who's diagnosed with polycystic ovarian syndrome. As a condition, you know, and I could say, I guess a more accurate way to think about this is all of these are interrelated with each other, and they can be considered a chicken or the egg cycle. So women with PCOS are at higher risk for developing obesity, metabolic syndrome, type 2 diabetes, difficulty getting pregnant, cardiovascular disease. But we also know that women with metabolic syndrome, or who have abnormal weight gain, are also at risk for developing PCOS. So there is this interrelationship, and hard to say what came first or what causes which based on the complexity of the hormones that are involved with this condition. And that comes into play when we think about what treatments to do and in what order. Conventional treatments for polycystic ovarian syndrome, if in the conventional medical world, if you were to see a DO or an MD, excuse me, Oftentimes the recommendations are, well, you need to lose weight, and then that will improve your the risk factors for developing other conditions. Or OCP stands for oral contraceptive pill, which is a form of hormonal birth control. And that's typically recommended to manage the symptom of irregular periods. It can be very effective for women. Some women do experience side effects, or they notice that they're actually gaining weight themselves, or have some mood changes or sleep disruption, and so it's not always an option that they feel comfortable doing, even though it can work to address the symptom of irregular periods. Metformin is a very common drug, particularly for women who may be overweight, have PCOS, and are trying to get pregnant. There's really good evidence showing that it's very effective for improving fertility outcomes. There are some side effects associated with this medication. Some women have kind of vague gastrointestinal symptoms or upset. Some women, a lot of women actually in my practice that I've talked to, have reported like a metallic taste in their mouth. And even though sometimes it is the best medication for a patient, there's also what we're learning in the evidence that I'll show on a couple slides, some very safe and effective alternatives to metformin. And spironolactone is what's called an androgen antagonist. So this drug is one of its actions is to block the elevated testosterone or other elevated androgen hormones that may be causing some of the abnormal hair growth or the acne or the changes in hair thinning around the scalp. So the way that I think about how naturopathic medicine can help with polycystic ovarian syndrome is, one of the things that we learn really well in naturopathic medical school is looking at and treating the whole person as a system, as well as coming up with an individualized approach that's going to work for that patient. So I always start with, what are the goals of the patient coming to see me with some of these symptoms? It may be that they want to try to get pregnant. It may be that they want to see if they can decrease or change how their acne appears, and improve that. It may be that they really want help with the metabolic dysregulation associated with this condition, so help with losing weight, eating differently, so that can also in the long term improve their possibility of getting pregnant once they're ready to start trying. So most naturopathic, I think it's safe to say most of us naturopathic physicians will always make some sort of dietary and lifestyle recommendations for our patients, and I'll touch on the next slide some specific ones that I make for PCOS. I also incorporate botanical or herbal remedies. There's some specific herbs that are really useful for this condition, as well as some specific nutrients or vitamins that are helpful as well. And then always I'm trying to take a step back and again kind of take that whole person individualized approach and look for other areas where I can help this individual reestablish the foundations for their own health, so their overall optimal wellness. And this may be looking at sleep. This might be, how can we incorporate some mind-body therapies that work in your life, in your routine, and that's always an important component to consider. So this slide is, there's a lot going on in this slide. So I want to bring your attention to the top half, to these three boxes. The bottom are specific references from the research literature that support each of these that I've listed. And this is how I think about my treatment approach to PCOS. So as I've mentioned, we've got a couple different ways that this condition can present and can affect women. So in looking at each box, there are some specific recommendations that will address that component of the condition. This is not an exhaustive list. I've only included 2 to 3 because I didn't want to overwhelm our attendees with so many different things we can do. So please know that there are a lot more studies and a lot more options that are evident, that show good evidence and efficacy for each of these aspects of PCOS. So for example, we know that a combination of interval training and aerobic exercise can be really helpful for not just losing weight, but improving the hormone response to why that person probably gained weight in the first place. So looking at blood sugar and insulin balancing. Chromium and inositol are also very effective, and this might be in addition to or instead of a metformin prescription. In the middle box, looking at luteal phase support, so luteal phase is the second half of our menstrual cycle, and that's typically the part of the menstrual cycle that where from ovulation until the first day of our period, where we see the most changes and in the sex hormones and therefore in the pattern of our period. And so these are two, one herb and one nutrient that I use most commonly for improving ovulation and improving the second half of our cycle to help normalize and get the cycle back to regular. Vitex agnus castus is also known as chase tree berry, and N-acetylcysteine you'll often see over the counter as NAC. I'm not listing any specific dosages here. I do recommend working with a healthcare provider if you are interested in trying any of these options. And then moving to the third box, for androgen excess, so that's that elevated symptoms of elevated testosterone, Ceranora repens, which is saw palmetto, and flaxseed are some common starting points for me when I make my recommendations to patients. So here's a case study that I want to share, and I see I'm mindful of our time, so thank you for your patience. So this was someone I just saw last October. It was a 32-year-old. Her main complaints were really cystic acne on her cheeks and her chin, and new chin hair growth that was dark, as well as thinning hair. Her words were, "I feel like I'm going bald." She was reporting kind of thinning hair and with no signs of regrowth, so she wasn't seeing any new hair grow in around her scalp along her forehead. And then when asked about other symptoms, she was reporting that she had gained weight in the last 2 to 3 years without really any change in her physical activity level. She, whenever there's complaints about menstrual cycle or where I suspect hormone imbalances, I'm always going to ask details about a woman's menstrual cycle pattern, including do they experience PMS. So her PMS was that her acne gets really bad and her breasts get quite sore. She says that her menstrual cycle pattern was regular, meaning she got them at regular intervals, but when she did get her period, they were quite heavy with multiple clots, night sweats, and she bled for 7 days, which is a little longer than I would say is a normal healthy menstrual cycle pattern for a 32-year-old. She also talked about a tendency towards constipation and recurrent hemorrhoids. And she had no current goals to get pregnant, and commented that, a few years ago was a really tough year with many life changes. So she had a significant family member, a sudden loss, which they were still grieving about. Both her and her husband changed jobs, and their dog had recently died. So this was a tough year, and I suspect contributing to why she was experiencing some of these symptoms now. So my initial recommendations for this patient was to order some labs. I wanted to look at her thyroid function, her cortisol levels, which is related to adrenal gland function, as well as some of the sex hormones, so testosterone, progesterone, and some other blood tests that I'm happy to give more detail in the question and answer. Physical activity, she was someone who wasn't going to exercise very much. She didn't enjoy it. However, she just had started roller skating and trying that, and that was fun. So I was encouraging her to keep going with that and see if she could get to an aerobic level of her roller skating so that we could get some benefits from that physical activity. And then for nutrition, just some pretty basic dietary recommendations in terms of improving her quality of food and what she was eating with every meal or snack. But here I want to highlight, I did quote prescribe that she take ground flaxseed every day, and that was one of my recommendations to address the dark hair growth and the acne. And then for supplements, I recommended she take Vitex every day, and that's also to improve her menstrual cycle pattern. And then incorporating some sort of mind-body connectedness with walking and spending time outside. So in December, a couple months later, I saw her for a follow-up, and she came back very encouraged because just after a month, she had noticed that her skin, her acne, was 95% improved. She also noticed that there was less facial hair, new hair growing in, and that her scalp, her hair growth in the last 2 months was also improved, noticing new hair growing in where other hair had been thinning and falling out. Her bowel movement pattern was better. She was no longer constipated, no flares of her hemorrhoids, and she reported less breast tenderness, and her acne was better with her PMS. So my follow-up recommendations was basically keep doing what you're doing, and really emphasizing eating well as let's see if we can build upon her aerobic activity with the roller skating, and maybe consider doing some body weight exercises in an interval way, and then follow up in 2 to 3 months. So I did get an email update from this patient a couple weeks ago, and she said that her symptoms had continued to improve in terms of her skin and her hair growth. Decreased dark hair growth, increased hair growth on her scalp, and she was still roller skating. So that, I think, is a nice example of how kind of minimal recommendations really helped improve her symptoms. Dr. Janas, how am I doing on time?
You are fine.
Okay, so I wanted to segue into talking more about the profession. This is something I think all of us speakers get asked. Why naturopathic medicine? I really treasure my naturopathic medical training because of this emphasis on treating the person that's in front of you. And this includes not just taking the time to listen to their story, listen to their concerns, but also developing a therapeutic relationship. I think all healthcare practitioners have a unique role where they can really educate their patient and empower their patient to make healthy changes in their behavior towards wellness. And so I really value that as part of my training to make sure that I do that with all of my patients. I think naturopathic providers typically have a lot more tools at our disposal to work with patients for achieving wellness or addressing their health concerns or symptoms. We learn a variety of modalities in addition to pharmacological interventions, which do have a very important place, and I will prescribe meds when indicated and necessary. But before I get to that step, I really like that I have a lot of other options that I can consider to share with a patient and figure out a plan that works best for them. And then as a naturopathic doctor, me personally, and I encourage my students to think about doing this, is really being a bridge among different ways of looking at healthcare systems, and what does healing really look like. And I think we have a unique perspective to participate in those conversations. So looking forward, professionally, I guess I would share my future plans are to stay in academia as a naturopathic doctor and enter into a little bit more research opportunities. So this summer I'll be starting something called a Health Disparities Research Certificate Program, and I'm hoping that will, I plan to utilize that as I then apply for a Master's in Public Health program, specifically in Health Policy and Administration. So that's what all of those initials mean under my future plans. And then in talking to all of you out there who are considering attending naturopathic medicine medical programs, I would just advise you, if you're not already, to be consistent with your own self-care. Healthy doctor equals healthy patients. And so I think healthy student equals healthy learners as well. So take regular breaks for yourself, whether that's just 5 minutes of breathing or going for a walk outside or meditating or finding out what a self-care break works best for you in your life. And then reaching out early and often to others that you notice are already doing what you're interested in and build networks. And I think that can be really useful for how your career may play out in your future. So that wraps up my presentation. I'm sorry it took so long to talk about myself, and that was the part I was most nervous about. So I will pass it back to you, Dr. Janas.
No, not a problem. Would you mind just putting up the slide with the upcoming events real quick?
Yes.
Thank you. Awesome. So if you enjoyed today's webinar, we have upcoming AANMC events as well. So in April on the 11th, we are going to have a free webinar with 2 admissions representatives to talk, if this has interested you, on how you too could become a naturopathic doctor and help patients very similarly to the way that we were talking about today. In May, our webinar is from a naturopathic medical student. Actually, the president of the Naturopathic Medical Association will be joining us to talk about what it's like to be an ND student. And then in June, we have a naturopathic doctor and United States veteran talking about his work with post-traumatic stress disorder in both the general population and veterans. And so we always have lots of different types of webinars, and I hope that some of these will interest you and you can join us again. Do you want to go to the next slide? Thank you. So if you have any additional questions, Jamine, I'm getting a little bit of feedback from you. I'm not sure.
Okay.
Thanks. So if you have any additional questions, and here is our contact information. And so with that, I am going to go to a few questions right now. So the first question that I have is in regards to the patient case. You mentioned that the patient had had some life stressors prior to an exacerbation of the symptoms. Would you mind talking a little bit about the relationship there and why is that important for you to know?
That's a really important question. We know that there's emerging evidence with regards to how experiences that are perceived of or internalized as stressful, or pain is a stress, grief can be a stress, anticipatory anxiety is a stress. But there is some really interesting evidence how that has a physiological effect on our brain function, and that has a kind of a downstream impact on our hormones, our immune system, and our mood. And so it is something that I always think about with regards to, especially when a patient will say, ever since X, I've noticed that my period is so weird. And so then I get curious and say, oh, well, what was happening right before X, or right before that date? So there is an interesting field now, I guess it's its own acronym, but called Psychoneuroendocrinology. So it really is looking at this interplay of our perceived experiences, how we internalize that, and its impact on our immune system, our mood, and our endocrine function, our hormones.
Thank you so much. So there was a question about, I'm getting that feedback again. There was a question about the nutritional component and weight loss component of care, and that often that is one of the more difficult ones to actually get compliance on. Can you speak about some of the tools and tricks that NDs use to help guide patients through some of the more kind of sticky lifestyle changes that may need to happen for long-lasting health?
Yes. I think this is where the time to have these types of conversations become really important with patients. Sometimes I'll recommend that they set up a 15 or 20-minute visit just to talk about this exact issue. And I think it's an important interplay between patient's motivation And patients' understanding of why diet, what they eat, is so important to how they feel or how their body responds to what they eat. So some of strategies that I have found helpful is really educating my patient. Sometimes I'll draw pictures, I'll pull up, I'll Google graphics that might help them understand certain, it depends on the condition, of course, or the symptom, but, and then really putting it back on them, helping them feel that they're in charge of their own health decision making. That's typically why people will seek me out as a naturopathic medical provider, and really say, well, what are you willing to do? Where is the wiggle room? Is it that we start with just walking around the block, or are you able to drink water or tea instead of that one soda a day? So making small, measurable changes really does help those changes be sustainable in the long term for overall behavioral change.
Thank you. And, the other component that I think is unique in naturopathic medical school is the amount of training that we get for lifestyle counseling and, not just conventional psychological counseling, but lifestyle counseling, and exactly those types of changes, the barriers that each person is going to have. Dr. Blesoff talked about cultural differences in the beginning, and your passion for learning about other cultures. And one of the things that I've found with patient populations is oftentimes many of our habits can be cultural, and there may be other aspects to work through, and just a general awareness of what people are doing. Years ago, I had this adorable female patient who was struggling with weight gain, and she was Mexican American, and we talked about all sorts of different things that she could do in physical activity and what have you. And when it got down to diet, I asked her what she was eating every day, and she would have an egg in the morning and have a little bit of soup in the afternoon, and and maybe some chicken during the day. And I said, in my brain, like, that doesn't quite add up to to a 50, 60 pound weight gain. And what else is going on here? And so I said, what do you have? What else do you have with the egg? Oh, tortillas, of course. And they said, well, how many? How many do you have a day? And she answered about 17. And for some of us, we were like, 17 tortillas, but for her, it was a cultural part of the day. It was part of the meal, and she wasn't even giving it a second thought. And so, I think for some folks, just having an awareness, one of the areas that I've always liked to add along with, with any lifestyle changes is that awareness piece and just making conscious decisions. And so I think, you talked about the different aspects that the NDs can play, but also, putting some of the responsibility on the patient and making a conscious decision. So is this decision that I'm making right now moving me in the direction I want to go, or is it moving me away from the direction I want to go? And at least making that choice consciously rather than just grabbing for something because it's a habit. So thank you. You have anything else to add on that before I go to the next question?
No, I'm really glad you touched on the cultural competency is important when you are getting details of a patient's diet, for sure. Thank you for saying that.
No, of course. So let's see. So there's a question here about PCOS belly, and I know you talked in generality on the hormonal components. And the question is in regard to the exercises for PCOS belly, but I know it's so much more than just that, because the adipose tissue comes as a result of sugar dysregulation and hormonal components. So do you want to talk a little bit maybe about that specific part of polycystic ovarian syndrome?
Yeah. Excuse me. So I would say with regards to that, again, this is multifactorial, so there's not one recommendation that's going to be like the magic bullet for everyone with PCOS belly. I've also heard it referred to as cortisol belly. This is, there are definitely some herbs in addition to that mimic or have a similar action to the medication of metformin. Dr. Janas mentioned kind of addressing why the adipose tissue formed in the first place. But I will say in terms of improving, you know, that function or reducing in size, it really comes down to a combination of minimizing carbohydrate in the diet, optimizing fiber. Dietary fiber is really important here, and then also specific types of exercise. So I did mention both aerobic and the interval strength training. We are seeing that women who are able to actually build muscle as opposed to, quote, lose weight or lose fat, it's the building muscle itself from the strength training that's actually changing the hormone metabolism to then burn that excess adipose or reduce that excess adipose, utilize it as energy. So it's both diet, but also specific types of exercise that are going to be really important for addressing that concern.
Are there any times of day that are better for implementing that exercise than others?
Oh, great question. You know, it depends. It depends on the person. It depends on their circadian rhythm. It depends on their sleep quality. So I'm going to look at a couple other elements before I make a specific recommendation of what time of day. So again, you know, you'll hear that a lot from us naturopathic doctors is it depends, because we try to be as individualized as we can. But in general, whenever they can fit it in, honestly. So if the only time someone can exercise and lift weights is at 7 p.m., as long as it's not affecting their sleep, I'm okay with that, because I would rather they try to get it in.
Thank you. Are there any other supplements? I know you briefly mentioned some for the hair growth and better hair growth patterns on the scalp.
Mm-hmm. In general, I think about, you know, in terms of hair, skin, and nail integrity and healthy new growth. Antioxidants are really helpful for that. Vitamin C, so anything that's supporting connective tissue and follicle health and healthy cell turnover. So I may consider those as options.
Thank you. What is the most challenging thing that you see when you're working with patients with PCOS?
It depends on what aspect. There I go saying it depends again. You know, I've had a couple of patients where their goals are to get pregnant, and you know, there's been some difficulty improving their ovulation pattern. And sometimes we've had to then go ahead and co-manage with a reproductive endocrinologist. So I don't think that that's super challenging. It's just I would have liked to have been successful from the get-go, but I'm also really thankful that there are other specialists and other types of healthcare providers that I can work alongside with. So I would say, you know, getting pregnant can sometimes be challenging. And then, you know, as other commenters have alluded to, you know, the losing weight can be really challenging for people because it really does require some significant behavioral change that sometimes just is frustrating or feel impossible for patients to do. So I have a lot of empathy for that. It can be really, disappointing or discouraging. But again, kind of going back to small measurable changes is the only place and a really good place that we can start.
Thank you. And I know that you talked a little bit about pearls with students, and you know, if somebody is considering this as a career, what would you say in regards to the preparing yourself best to be a student? I know you're faculty for both the chiropractic and ND programs at NUHS. What would you share as a tip there?
Oh, thank you for asking that question. You know, I think I was just commenting, Dr. Janas and I were just commenting about this a little bit, is that, you know, I recognize that student learners are really different today because of all the devices and screen time and information that's literally at our fingertips. I think it's important to have a good structure and routine of, you know, I'm going to work on, dedicate X amount of hours, as opposed to I'm going to go study. You want to have actual chunks of time that you limit yourself a beginning and an end for a topic or for an area. The other thing I would recommend is making sure that people are sleeping. You're going to perform way better on exams and retain information much easier if you are well rested and you're taking care of yourself and your body. The other suggestion I would recommend is be accountable for your learning. Because the student learner looks different today than, say, 10, 20, 30 plus years ago, our teaching methods are going to be different. So we are utilizing a lot more technology. And so we are expecting students to be prepared and be accountable for their own learning. So we're not going to keep, just spoon feeding it. And I think particularly going into any type of provider profession, working with other individuals, you're going to be in a role where people look to you for answers, and so you want to be as well prepared for that. And the best way to do that is experiential learning and application. So I hope that answers the question.
Yeah, no, that was great. Any tips on someone choosing the best ND for themselves? I've had a few folks here saying, oh, this sounds just like me, or oh my gosh, I have this and this has nailed it. And there are a few questions that have come in on, supplements and adaptogens that I think honestly folks would be better served to have, an ND working through their case with them. So how do you let somebody, how do you recommend someone find the best ND for them if they're going through something personally?
Well, I think it depends on the state. Definitely whatever state you're in. I'm pretty sure almost all of 50 states have a naturopathic association or professional organization where members are listed. And so you always want to look for someone who says that they're a naturopathic doctor and that they've attended an accredited naturopathic medical college. And so that's my first tip in terms of like Googling or looking for, naturopath in Missouri or something. The other piece is then calling the office, looking at the website, look at what population or conditions that this ND specifically works with or considers themselves an expert in. More and more of my colleagues are actually looking into and developing ways to do telemedicine. So virtual visits may be an option if there is an ND that someone enjoys following their blog. Maybe they can set up a virtual visit that way.
Thank you. You've mentioned a few times supplements like metformin. Are there any specifically that you had in mind?
Oh, in terms of similar mechanism of action?
Correct.
Okay. So berberine is one, which is from Hydrastis or the berberis plant. And inositol, myo-inositol, and N-acetylcysteine.
Thank you so much. So there was a question earlier about, not exactly related to this, but one that we get often that I wanted to touch on, which was what is the career outlook, the job outlook for NDs? And the one thing that I will say is, and this has been a super exciting week for those of us in the naturopathic world, naturopathic medicine is absolutely growing in interest. The types of cases that Dr. Jamine talked about today are just a handful of the experiences that patients have with naturopathic medicine when, they may have been in the conventional model, not quite getting the level of resolution to a problem that they want. And, PCOS is a very common condition and a good example, I think, of patients who have issues who, may just be given medications for a symptom, but not necessarily addressing the root of the issue and teaching folks how to manage it on their own. And so this week alone, there are 2 states that have passed licensure bills that are now waiting for the governors of those states to sign into law. That's Idaho and New Mexico, and we're so excited. And so, when I got that question about job prospects and job outlook, we had written an article back in May of 2018 on the job outlook for naturopathic medicine and the increase in legislation passing across the U.S. increasing in insurers covering naturopathic medicine, increase in collaborative experiences across naturopathic doctors and medical doctors working together. And so there are so many different ways that NDs are working across the country. And so the one thing that I will say from my own personal experience, having been involved in this profession for over 20 years now, is really the folks who are passionate about this and see the benefit of naturopathic medicine and what we can offer patients are, and our patients themselves are such large advocates for what we're doing that we're growing leaps and bounds. And I think that when and Dr. Blesoff, I don't know what your experience has been. I know you're in Illinois and you all have been working on regulation there too. But we are just seeing from when I started, back in 1996 with 3 schools, the number of schools has doubled, and we have, now the states that are regulating naturopathic medicine, the opportunities. The Veterans Administration has hired their first naturopathic doctor in the state of Texas. There are things that are happening that just signal to me that this field is growing so much more than I could have imagined back in my little 1996 self. So I don't know if you have anything to add there.
I mean, I agree with the positive momentum that's occurring just in the last month. I will say just this week here in the state of Illinois, there was a piece of legislation introduced to the Healthcare Committee. Now it's got a few more steps to go through before it actually reaches a final official vote, but that's momentum and that's movement also here in Illinois. I definitely think in terms of career opportunities for NDs seeing patients, there's, the options are boundless. Like patients are seeking us out. So what I would like to see personally is more of an interest and direction and momentum getting more into research showing the efficacy of the model of our medicine. How well naturopathic medicine is actually helping and can contribute to some of the healthcare disparities within the current model that we have. So that's my kind of like, hey, if you're interested in research, please, we need you. In addition to, we need more naturopathic doctors.
Yeah, and I agree. I think the demand from patients is definitely outpacing the number of doctors that we have available. So there is a demand, there is a need, and I think it's an exciting time to be an ND. So with that, I am going to close the webinar today. Thank you so very much for being with us. And I'm getting that feedback again. Thank you so very much, Dr. Blesoff, for being with us today. I really appreciate the time you took, and I'm sure that we have a lot of happy folks here who have gotten some really good information and hopefully have some next steps for themselves to take either in their own personal healthcare journey or their career journey. And so again, thank you all for further information. You got the information up on the screen, and we'll have this webinar recording out to you guys shortly. And so with that, I will close the webinar today. Thanks again for coming.